but I suspect that this is actually not a classic case of tennis elbow, whether you want to call that lateral epicondylosis, epicondylitis, or just a tendinopathy. My dad has recently been having some what appeared to be some tennis elbow symptoms. So the outside of his elbow has been bothering him for probably the last 2 to 3 weeks, likely due to some things he's doing at work. Now, he's had tennis elbow in the past, and so he kind of had a rough familiarity with it, understanding that, you know, pains on the outside of the elbow, hurts when he does things with his hands and his forearms and things like that. However, the interesting thing is that, you know, him and I were talking the other night, and I was asking how things were going. He was doing some, you know, exercises that he had in the past. He was wearing that little brace thing that they put here, which basically just creates a new kind of insertion point for the extensors on the forearm. And he, you know, I asked how things were going, and he said that things were getting worse and they weren't really getting better. And so I start talking through this kind of stuff and asking how he's doing. And, you know, the other things that come up are, you know, icing was only moderately helping. And the other big thing for me was that he was taking ibuprofen and it wasn't helping. And this band was not helping at all. So, you know, one of the comments he made to me was that, oh, this is, you know, I know that this is tennis elbow, but I'm just not sure what to do about it. And that right there, I think, just really hit home with me in terms of the approaches that we have in the pain management world. So first off, I haven't done a physical exam on him, but I suspect that this is actually not a classic case of tennis elbow, whether you want to call that lateral epicondylosis, epicondylitis, or just a tendinopathy. But I don't think that's what's going on, because in those cases where we do have true inflammation, when we have epicondylitis, or we have a degenerative condition where we have epicondylosis, in both of those scenarios, ibuprofen almost always helps the pain. Now, it's not a cure, it doesn't last forever, it's temporary, but it almost always drops pain levels, okay? The other thing is, if we do have inflammation at the actual insertion or the enthesis of the extensors onto the lateral epicondyle, then we would see an improvement when we place that band around the lateral aspect of the arm to create that kind of new anchor point, because that decreases tension on that enthesis, the insertion. So I don't think this is epicondylosis, epicondylitis, whatever we're going to call it. However, I do think that this is a neurogenic inflammatory condition, right? We have the radial nerve that's wrapping around on this lateral aspect of the arm that can get caught in supinator muscle, and that can cause pain on the lateral aspect of the arm that can actually mimic lateral epicondylitis or epicondylosis.